we now talk to Cebu City Mayor Edgar Labella. Maayong buntag, Mayor. Thanks for taking our call. Please tell us how the hard lockdown in several areas in Cebu City is being implemented, and have you apprehended any violators so far?
Yes. Good morning, first of all, Ria, and to your TV televiewers. Yes, I concur with the statement of General Roy Senato that we are having like a strict lockdown on these top 12 barangays infested. But of course, we are really implementing it. And, one of the reasons, we had a meeting yesterday with all the 80 barangay captains. And, one of the reasons why it was really very difficult to impose the social distancing is because most, if not all of these 12 barangays, are barangays which are so thickly populated. And perhaps because of government neglect for so many decades, their houses are just placed very close to each other. And in fact, in many of these barangays, the houses are just separated by walls. That's one of the reasons. But of course, we really have to impose and strictly enforce social distancing. That's why I am happy that with the presence of General Simato and, of course, the other members of the ITF, that we will be able to really strictly implement the very minimum health standards. And of course, considering that they are on strict lockouts, the city, of course, will provide them with food and subsistence because most, of not all of the people there are prohibited from going out of the barangay or the sitios.
Mayor, what are the penalties or punishments for quarantine violators?
Well, actually, as early as April, I proposed an ordinance to the City Council that there will be the first penalty would be community service. That's what we've been doing now, only community service, because that ordinance has not been passed and enacted yet by the City Council. But in that ordinance, which I proposed, that there is, for the first violation, there is like a community service, and that is what exactly we are doing now. And then penalty of imprisonment for, let's say, 1 month, then the third violation for maybe 1 year, because under the local government code, we cannot impose a penalty higher than 1 year imprisonment by the local government. That's the limitation under the local government code. But at the moment, we have big trucks or buses here. We call them kausyong buses, where we detain actually those who violated the protocols. And then we bring them to the Plaza Independencia, that's a big plaza. And then in the meantime, lecture them for 8 hours and then ask them to clean the premises. And of late, we made it a little stiffer by allowing them to clean the canals. But in fact, our attention was called by the Human Rights Commission. But nonetheless, we will strictly implement it. And hopefully the City Council can approve the ordinance which I proposed, making a penalty, the worst penalty of 1 year imprisonment.
Mayor, have there been a lot of violators so far?
Well, actually, since General Simato came, I think there were already quite few violators. But of course, we will continue and we will be more relentless in the enforcement and strict implementation of the protocols.
Sir,
But as I've said, these areas are really very thickly populated. And their houses are just separated by walls. Sometimes you understand them that they are not quite inclined to stay inside their houses because, some of these houses, they sleep, the living room, that's where they sleep, they eat, and, it's just, I know you have an idea of what these small houses or shanties look like. That is precisely the reason when I immediately assumed, because this is my first term as mayor, when I assumed in July, one of my pet projects is the establishment of vertical housing units. And in fact, we have started already building, constructing 3 tenement houses so that I could place all these people living in subhuman conditions because of government neglect for so many decades, place them in at least decent vertical housing projects. In fact, I had already made collaboration with the Secretary of Housing, Secretary Del Rosario, together with my housing people, so that by slowly but surely we can let these people living, especially on danger zones, like beside the creeks or rivers, to be placed in at least decent vertical housing. And we have started constructing it. I think we have started constructed three building, three vertical that can accommodate 100 families per building, 4-story building.
Right. Mayor, and until when will the hard lockdown be imposed?
Well, that would depend on the conditions, but some or many of these, like for example, Barangay Mambaling, Alaska, they used to have about 300 positive cases, but now there are only 19. But since 19, lockdown is still being implemented.
All right, so it will really depend on the numbers, no?
The number, of course.
Yes.
But, the lockdown, we agreed with General Simato that there could be like segmental lockdowns. Lockdowns not necessarily in the entire barangay, but lockdowns in like households, streets, or sitios, or they call it in Manila as purok, no? We will impose in that manner if it is not really necessary to implement a lockdown on the entire barangay.
Mayor, since the quarantine passes that were earlier issued have been canceled, how can residents secure a new one, and what are the guidelines for that?
Yes, it's good that you asked that question. Immediately after yesterday we called a meeting to all the 80 barangays, and we asked from them list of their residents in the barangay, and it was being reconciled last night. My staff, my secretariat has not even slept yet, because today, this afternoon, after our press conference 10 o'clock this morning, we will be distributing queue passes. And in that queue passes, it's one member per household. And they are really very strictly selected. And in that queue passes, we also, place therein the guidelines. And upon my suggestion and with the agreement of the task force created by General Simato, that there will be like clustering of barangays that can go out. And we agreed yesterday that a number of barangays can go out on, let's say, MWF, and then this number of barangays can go out on TTS, and maybe no one should be allowed to go out every Sunday. So that not all barangay folks or barangay residents will converge in the city or will go out and stay in the city streets. And in addition, I have also, because with the implementation of ECQ before, I implemented a mobile market that can go to the far-flung barangays, especially to the mountain barangays, because, we have a lot of mountain barangays. Cebu City is 75% mountainous and hilly, and we only have 25% flatland in the urban center.
Right.
So that to prevent people from the barangays to go down, we have implemented a program. We call it mobile markets that go to the different barangays.
Yes, very important to make food accessible. Now, local
That's
officials
correct.
of Cebu, as you said, met with the Cebu COVID-19 response point person in Secretary Roy Simato yesterday. Based on that meeting, sir, what other measures will be put in place to further prevent the spread of COVID-19?
Well, of course, there were some incentives that could be given to barangays who really do not have enough or do not have many cases or zero cases, because I think there are about 20 barangays that are still zero case, no? And we will be giving them incentives.
All right. As of the latest, Mayor, how many confirmed cases does Cebu City have, and what does the hospital occupancy look like so far?
Well, firstly, as early as late March, we already started, before many other local governments started mass testing, because we believe that the most important components in the fight against coronavirus is testing, contact tracing, isolation, and treatment. And we've been doing this since the last week of March. So that's why many would even tell me, stop mass testing, because that will only increase the number. But I said, no, I believe it is my moral and legal duty to really conduct mass testing, because this is the only way that we can prevent the virus. So as of now, I think, as I do not have the figures with me because I'm still in my bedroom, there are about 4,000 more or less. But of the 4,000, 2,000, more than 2,000 have already recovered. So I think we have a an active case of 2,000. And I'm not sure yet on the mortality rate, but as of the other night, we still have one of the lowest. I don't know what happened yesterday because, we can never tell. Our mortality rate 2 nights ago, I think, is only 1.08%. And our recovery rate is something like 48 to 50%. Now, if you ask me on the hospital occupancy, our private hospitals here had committed that they will increase the hospital occupancy for 30%, especially the private hospitals. But I would like also to point out that hospitals, level 3 hospitals in Cebu City, do not only admit patients from Cebu City. Level 3 hospitals, the big hospitals like Cebu Doctors, Perpetual Socor, Chongwa Hospital, they are like level 3 hospitals that even patients from the neighboring island provinces of Bohol, Leyte, a part of Negros Oriental, are being brought here for treatment. So, but as I've said, as of now, I think we are not overwhelmed because we have also our so-called barangay isolation centers. We have, for the positive asymptomatic, we place them in our barangay isolation centers. And for the mild moderate, we place them in our quarantine centers. Cebu City has a quarantine center equipped with all the negative pressure, and I think it can accommodate 160 to 200 patients. And then we have also the Bayanihan Center, sponsored by the Ateneo de Cebu, Sacred Heart School. And then also there is one that's being put up by Archbishop Palma. We call it the International Eucharistic, that can also accommodate about 200 patients. And these are not filled for moderate, mild, moderate cases. And there's also one being constructed through the initiative of the Sangguniang Panlunsod, the NOAA complex.
Right. So, Mayor, just to clarify,
yes,
the lockdown is already being implemented in Cebu. Is that right?
That's correct. If it's an ECQ, it's really in effect a lockdown. But there are only certain exceptions, like for example, government workers and those who are working on essential companies, like food manufacturing companies, BDOs, and there are exceptions. But strictly, it's really like a lockdown because people are prohibited from going out of the residence. They are told to stay home, but only those. But one of the exceptions is that one member of the household is allowed to go out to buy food or medicines, and of course, on emergency hospital cases.
All right.
And we will be distributing this afternoon our new
quarantine
set
passes
of quarantine pass that contains also the name of the person, the sitio, like Puruk there in Manila, and of course the barangay, so that those who will be using passes that do not bear their name, of course, will be rejected.
Right. Okay. Thank you so much for your time this morning. Daghang salamat, Mayor Labella of Cebu.